China is facing a new outbreak. But this time, it's not COVID. It's called HMPV, Human Metapneumovirus. Could this obscure virus be the next global threat that no one is talking about yet? Stay with us, because by the end of this video, you might start to question just how prepared we really are. Let's start with the basics. HMPV is a respiratory virus first discovered in 2001. But here's the twist. Scientists believe it may have been circulating for decades prior, quietly infecting millions. The symptoms: cough, fever, nasal congestion, all too familiar. So why is HMPV suddenly making headlines now? Reports coming out of China suggest a surge in cases, with some hospitals overwhelmed by respiratory patients. According to data released by the Chinese National Health Commission, cases of HMPV have spiked by 60% in certain regions. But here's the kicker. Unlike COVID, there's no vaccine. A study published in The Lancet found that nearly 10% of severe respiratory cases in children under 5 were linked to HMPV. And that's just one demographic. Imagine the potential scale across an entire population. Now let's break down the science of how HMPV spreads. The virus transmits through respiratory droplets, much like influenza or RSV. It thrives in crowded places, schools, public transport, shopping malls. But unlike the flu, HMPV has a longer incubation period of up to 9 days, meaning by the time symptoms appear, transmission could already be widespread. And here's where it gets even more alarming. Studies show that HMPV reinfection is common. Yes, you heard that right. Immunity isn't long-lasting. So what does this mean for the rest of the world? Experts warn that as international travel ramps up post-pandemic, the chances of HMPV crossing borders increase significantly. In fact, the European Centre for Disease Prevention and Control recently issued advisories for travellers to and from Asia. But here's a question to consider. How prepared are global healthcare systems for yet another viral surge? Remember the SARS outbreak in 2003? It started in Asia but spread across continents within weeks. Could HMPV follow the same trajectory? HMPV poses the greatest risk to the most vulnerable: infants, the elderly, and immunocompromised individuals. In severe cases, it can lead to bronchitis and pneumonia, often requiring hospitalization. But don't breathe easy just yet. Even healthy adults aren't immune. And asymptomatic carriers can unknowingly drive the spread. So is there a way to contain HMPV? Currently, treatment is limited to supportive care, oxygen, hydration, and antiviral therapies in severe cases. But prevention, as always, is the strongest weapon. Hand hygiene, masking in crowded places, and avoiding contact with symptomatic individuals can drastically reduce the risk. But will that be enough? Or are we already too late to stop HMPV from spreading beyond China's borders? Here's the takeaway. While HMPV might not spark the next global lockdown, its potential to strain healthcare systems and affect millions cannot be underestimated. Governments and health agencies must act decisively, learning from past mistakes. Because if there's one thing we've learned from pandemics, it's that underestimating a virus is the fastest way to let it win. If you found this video insightful, make sure to like, share, and subscribe. Knowledge is power, and staying informed is the best defense we have. Until next time, stay safe and stay curious, and stay